Have you ever been to a dentist?
Yes, obviously. I look after myself.
Okay, when I used to be a child and I used to go to a
Did you
dentist.
ever go to a dentist?
Oh yes, whenever I used to.
Yeah, she's been going to a dentist.
Okay, so the thing is this, whenever I used to go to a dentist, it used to be very scary for me.
Okay.
And I used to get scared from those needles, from those instruments, from all those apparatuses, and that used to be very scary for me, the sight of it.
Yeah.
And you know, like whenever I used to go to the dentist as a child, they used to be like, "Aur muh kholein, aur muh kholein." And it used to be very difficult. As a child, it gets very difficult for us. So, you know, everybody who has been to a dentist, they can relate to all
Yeah,
this stuff.
exactly. But I think, you know, the point that we're trying to make, or Sadaf is trying to make over here, is that for us, you know, who can actually kind of contribute towards day-to-day activities or kind of carry their day-to-day activities by themselves is something very different, you know, looking after your hygiene, your dental hygiene in particular. But imagine that, you know, this gentleman over here in the studios with us actually deserves a standing ovation, and it's because of the fact that people or children, you know, who've got cerebral palsy, slow learning capability, aggressive behavior, Down syndrome, and all of those children with special needs, they have been treating them, and that too for free. Ladies and gentlemen, we're very lucky that we've been joined by Chairman Al-Ahad Welfare Trust. He is Dr. Lieutenant Colonel Abdul Razzaq. Malik Saab. Hello sir, Assalamu alaikum, good morning. Thank you so much for joining us.
Walaikum salam. Thank you very much
So
for
first
inviting
of all,
me.
you truly deserve a standing ovation, and I'll try to do that as well. And it's because of the fact that for all of those children with special needs, you've been looking after them. Your welfare trust has been looking after them as well. But first things first, sir, how did you come up with this idea that children, you know, who might have difficulty in doing things by themselves, you are going to actually kind of make them get rid of caries, you know, you'll get them scaling done. If there's any surgery required, they will get it done as well, may it be braces, dentures, anything, and that too for free.
Thank you very much, first of all, for inviting me. And I'm in the field of this dentistry for the last 40
You're a
years.
maxillofacial surgeon, you're a professor yourself, mashallah.
Alhamdulillah. In the start, I was just a simple dental surgeon, but then I got a specialization in maxillofacial surgery, which is basically the plastic surgery or cosmetic surgery of a face.
Exactly.
If we talk about children with special needs, it requires special efforts to treat them. How do you manage that?
पहले मेरे सवाल का जवाब मैं दे दूंगा.
Let me answer first him,
yeah.
and then I will answer you as well.
I'm just pulling your leg.
Definitely,
I know
I will answer your question as well.
Yeah.
After doing my maxillofacial surgery, I thought that there are certain, I have been treating the children who are normal. Actually, Allah have made two types of people in this world. One is with having normal organs and normal brain.
True.
But there are certain people, they have normal organs, but they don't have a normal brain. So these children are called special children.
Yep.
So we need to treat them. Previously, I used to think that whatever I am doing something very big, because I'm a dentist, I'm treating them and I am relieving their pain. But when I saw that there was one man who was without eyes, he was blind. So I thought he deserved to be treated in a better way. So I started working on the blind people. Then I thought that there are certain people who are deaf and dumb.
Yep.
So then I thought that they are more deserving. Then I came to know that there are certain people who have their eyes, who have their ears, they can walk around, but there are certain people, they have all organs, but they can't work.
They can't function properly.
They can't function properly. So they are called special people. So we need to treat them. We need to help them. Because in Pakistan, we plan to make such a setup where these type of children are specially treated.
Exactly.
So in our this Al-Ahad Welfare Trust, we established a special setup for them in which we have provided them with very calm and comfortable environment. We make these children friends first. Once they come to us, we greet them, we give them toys, we have special waiting room in which we try to make them friends first.
Yeah.
And once they're in first visit, we don't treat them.
Okay, you just make connection.
We just acclimatize them with the environment.
Okay.
Because people, as you said, that people used to say, or mukh kholo, and normal people are unable to open the mouth,
Exactly.
and these special children don't understand what's going on.
Exactly.
And even their condition is so miserable that neither they can tell their problem to the dentist, nor the parents can tell them. nor the parents can tell us that what's wrong with them. So when they have swollen face and unable to eat for so many days, then you used to come to us, and the parents used to bring them to us. So we in first visit we acclimatize them with the environment, and then in second visit we treat them in different ways. So there are different ways of treating such patients.
Okay, so if we talk about children particularly, usually even children get very much scared whenever they have to go to the dentist. If we talk about children with special needs, if we talk about people with special needs, obviously there must be some they must be reluctant to, you know, like come to the dentist and make a connection and then open up the mouth and cooperate. How do you manage to do this all?
Very good question. Actually, the way I said that there are two types of people. One are normal and one are having abnormal behavior. The children who are having normal livings, but they're afraid of, they have phobia, they have some experience, bad experience of dentist. So they're afraid of coming to the dentist and unable to open their mouth. For them as well, we consider them as special children for the time being. So we treat them in a different way. We first give them some sort of relaxing medicines before coming to us. These are different type of syrups. So they relax, they're comfortable.
And then obviously it becomes easier for them as well. And you know, so I'm just going to ask my team, because I think I came across a video where you were actually teaching them how to brush as well. So if we could play that, it actually melted my heart. But while we're at it, sir, you know, because I've spoken about a few treatments that Al Ahad Welfare Trust is actually kind of giving away for free and for all of those children who are in special needs, what are the other treatments which I might have missed out on? You know, so if there are people out there, you know, if they're listening to you right now, so that they can get in touch, please.
Okay, thank you very much. Actually, the way you said the special children, we should understand that every child who is not having a normal behavior, even if he gets up at the age of maybe 40, 50 years, again he is a child, because his brain is a child's brain.
True.
So we call them as a child. So we treat them under sedation, intravenous sedation, by medicines, just give them nitrous oxide gas, which is laughing gas, so they relax. Or we give them general anesthesia.
All right.
So in one go, we treat them, because like you and me, when we go to the dentist, doctors used to call us time and again. But we don't call them time and again.
Okay.
In one go, when we have sedated them or given them dental general anesthesia, if they need to get some tooth extracted, we extract them. If some tooth is required to be filled, we fill them. If some tooth need to be replaced, we replace them.
Wow.
If the teeth need cleaning, we clean them in one go, so that they should not come time and again.
Wow.
So this is the way we treat
so
them.
that they do not actually have to go through the entire process over and over again, and it's painful for them.
Time
I think
again.
it's very considerate of you. And in addition to this, sir, now imagine that, you know, it is obviously, because while Sadaf was saying that, you know, when we go to the dentist, it is a very expensive and laborious procedure.
Yes.
And it's painful as well. So how do you make sure that Al Ahad Welfare Trust actually kind of make sure that they give all of these treatments, that too for free? And is anyone eligible? You know, because you just mentioned that, you know, that a person with Down syndrome, may he be or she be 50 years old, they'll still be like that as well. You know, so, and is it a, you know, lifelong process for them? Do they keep on coming back? So how does that work?
Actually, once I have not started this trust, I used to, I had a brain to just bring money to my clinic.
Yep.
But once I made this trust, because Al Ahad means, Ahad is the name of Allah, and Abdul Ahad was my father's name. So our own family made this trust. So our own zakat and everything used to be deposited in this trust, and our friends as well used to help us in this way. So we treat every patient who is having a special problem. So we treat them free whenever he comes, as many times he comes, so we treat them free of charge.
Okay, if we talk about your team, how many people do you have working for you for now, and how can people contact you and join you?
Yes, of course. Because in the start we just started with few people, with our own family and friends. But once we introduced this, and it is when some patient goes back and he tells to the others, so from man to man, this whole thing came into this whole idea came, rather spread to everybody. So now we have so many volunteers who themselves comes to us. We actually used to go to different schools, which are special schools,
All right.
special education schools. We go to them, we examine them, we distribute food to them, we give them toys, we check them, screen them, and then those children who need something, some treatment, we used to call them to our clinic.
Wonderful. Thank you so much, Dr. Saab, for being with us. Thank you so much for making our society more inclusive and equal as well. And I think that the kind of services that you're rendering for your Pakistani fellow citizens, it is something which is remarkable, and it's an inspiration for all of us. Thank you so much for being with us.
Thank you.
Lovely to be in conversation with you. And for everybody who's out there, ladies and gentlemen, such is the kind of stories that we really need to share each and every day. So may it be 2024, may it be 2025.
Exactly.
These are the people we would always want them to be on our programs.